Hello, my name is Emily Landis. Today we will be learning about quality improvement through effective teamwork. The purpose of this presentation is to explain the importance of quality improvement and how that can be achieved with teams that are collaborating and communicating well. Successful teams will have members who are experts in their field and excited about implementing improvements. They will use tools to measure quality and be able to analyze and study the collected data to decide if their plan is an improvement or if they need to make changes. Successful teams can resolve conflict and create a safe space for sharing ideas. Why are teams valuable? Teams are a valuable point to focus on when considering quality improvement in healthcare. Communication and teamwork are essential when working with an efficient team. When staff from the clinical and non-clinical sides of the team combine their knowledge and collaborate effectively, they can improve patient outcomes, prevent errors, improve efficiency, and increase patient satisfaction. Individuals on a team should be experts in their field, be excited about implementing change, and have team and leadership skills. Having staff from all areas of an organization involved in the team will allow room for improvement in diagnosing, treating, and providing patient care. Staff includes doctors, nurses, and healthcare professionals in administration. What distinguishes a team as high performing within a healthcare environment? High functioning teams create spaces where teammates are empowered to identify problems and produce solutions to the issues. This means individuals feel like they are contributing positively to make things better for the whole organization instead of just one department. When people feel empowered, they are more likely to feel a sense of belonging and commitment, along with increased motivation to help the organization. High performing teams can focus on functional and cultural change at the same time. This means improving communication, tracking progress, producing better processes, and defining each team member's role. Successful teams understand the goal and each member knows how they contribute to the team meaningfully. Teamwork can influence and impact quality outcomes when all members are collaborative and communicative, and each member does their part to contribute. Successful teams are like a puzzle. Each member is a different shape with their knowledge and expertise. They can communicate with their team with information relevant to the cause, creating easy collaboration. Positive change can be made if every team member is empowered to share their knowledge and be open to ideas. All teams have processes and varying roles that can impact quality assessment negatively and positively. When quality is assessed, all team members must understand the goal of improving quality. The point of quality is improvement. The point of quality improvement is to go through a process and discover if there are better ways to reach a goal or outcome. The original plan may not be the final one, and team members need to understand the end goal to achieve successful collaboration. The process of quality assessment may have to reoccur time and time again. This does not mean the goal changes, but the task being tested will change to reach the end goal. Different elements can affect quality assessment, such as leadership roles, individual responsibilities, delegation of tasks, decision making, and ongoing training. A common problem with teams is a lack of clarity about the team's authority to implement the change. Teams need to understand that implementing changes may not be their role, but to find changes worth implementing. Leaders can negatively affect quality improvement. Ego can get in the way of the main goal and make other teammates feel like they cannot express their ideas. Relationships and status differences within a team can affect a team's progress and should be eliminated so that work is not obstructed. Everyone on a team must understand their roles individually. If more than one person does the same thing, this is not working efficiently or effectively. Tasks must be delegated so that one member is not doing more work than others. Team members should be knowledgeable and capable of contributing equally to a project. Decision making should be done as a group. If a portion of the team decides without the entire group, it can negatively affect the project's outcome. If new information comes along that requires additional training or education, all members must attend. Progress can be missed if someone is not updated with new information. Leaders can positively affect quality improvement. A clinical leader has authority and can test and implement changes while overcoming implementation problems. Having a good leader is essential. They can diffuse conflicts, hold everyone accountable, and encourage participation. When teammates understand their roles, finishing tasks and staying on track will come together smoothly. It also keeps the team working together effectively and efficiently. When a leader can delegate tasks to team members based on their knowledge and expertise, this ensures that each part will be completed appropriately. Decision-making should be done as a group, especially when changes arise. When everyone comes together when making decisions, all angles of expertise and knowledge can be applied to make the best decision moving forward. This can be from voting on an outcome or everyone giving information to the leader and having the leader decide. New information requires additional training or education. All members should attend or acquire the information so everyone on the team has the same understanding. Learning new information can help change this perspective or approach to improvements. Cross-functionality enhances performing teams' ability. Cross-functionality enhances high-performing teams' ability to meet quality improvement in a healthcare organization because various experts come together regarding one common goal. Having a team that can stay positive while collaborating and respecting everyone's role is expected of a high-performing team. An interdisciplinary team consists of members from every area that would be needed when going through an improvement process. Members can be doctors, nurses, social workers, scientists, record keepers, front desk, and many more. Depending on the organization and the process will determine who will need to be involved in an interdisciplinary team. Within teams, there will be conflict, especially with a team of highly educated healthcare professionals. Conflict should not be a bad thing. When there is no conflict, things do not change. Teams with many different types of personalities may have conflicts with communication or start to distrust team members when it comes to decision making. This can be due to the culture of the team. Behavior and attitude should be optimistic for all team members. Everyone should be supportive of efforts put forward to reach the common goal. Having a good leader is critical to changing the culture of a team. Tensions that arise should be addressed with open style communication and active listening, where team members can ask open-ended questions with no judgment. This will allow everyone to get on the same page. Team members are not permanent either. People can be added or removed from a team for the best result. Elements such as conflict and change can affect the dynamics of a team and its ability to reach a unified goal. Conflict can be dysfunctional when it is emotional and takes away from a team fulfilling their roles and achieving their goals. Conflict can result in teams performing at a low quality level. It can result from disagreements on ideas, lack of communication, negative mindset, and can create blame. There can be competition within a team with power struggles and personal differences. Those causes can lead to uncertainty of commitment to the unified goal, irritation towards improvement, and less participation. The negative views of conflict will make reaching a goal impossible. There are positive ways to have conflict within a team. Having a rational conflict may lead everyone to a better solution. It can be good when conflict sparks change or growth toward a unified goal. It raises awareness when a problem exists, allowing a team to come together and produce new and improved ideas. Resolution can be reached when confronting conflict. Teams can understand each other better and are more likely to achieve goals. Teams require resources to function. There are material and non-material resources that are necessary. Material resources may be equipment needed to incorporate steps within a process or to measure results. Non-material resources can consist of regular meeting times for a specific amount of time, like a month or a week. This can support teams and give a sense of meaningfulness to the quality improvement task. The culture within an organization can affect resources. Depending on how supportive organizations are for teams, will determine the number of resources available for improvement. The only way to change an organization's culture is to have leaders commit to making positive change and improve quality improvement efforts. Rewards or recognition for teams or individuals can motivate positive change. When members have something to work for or receive acknowledgement for working hard and being dedicated, it can motivate them to keep going. It also brings attention to them that their work is appreciated and essential. Thank you for listening to my quality improvement through effective teamwork presentation. And here are my references.